Group 9, Qualitative Article Critique. Danielle Hudson, Diana Durham, Jamie Fife, and Caitlin Norris. The research article we critiqued is titled The Lived Experiences of People with Chronic Obstructive Pulmonary Disease, a Phenomenological Study. It was published in 2016 by the Journal of Nursing Scholarship. There were 4 different healthcare workers and researchers who worked together to conduct the study and compile the research together. Why was the study performed? The purpose of the study was to explore the lived experiences of people with COPD following hospitalization for acute exacerbations of pneumonia. The article extends knowledge about what it is like to live with COPD after being hospitalized for acute exacerbation of pneumonia by highlighting the lived experiences of these people. Life with the disease. Those with COPD describe living as if they are trapped in an invisible cage. They are tormented through the winter months and the cold weather. They often had a tendency to narrow the range of activities due to this. Despite all these actions, the patients with positive attitudes still strive for wellness and were willing to cope with their disease. Lived experiences of those with COPD. Patients found that wearing a mask to go through day-to-day activities increased their breathlessness, and they were forced to find alternative methods for preventing respiratory pollution. The introduction of the article introduces the topic appropriately and gives the reader a clear insight into what the material is going to be about. It does this while keeping the reader interested and engaged. The research problem is clearly stated in the introduction. It is the same as the purpose of the study, which is to examine and explore the lived experiences of people with COPD following hospitalization for acute exacerbation of pneumonia. The hypothesis or research question is not clearly stated in the introduction, but it still does a good job of explaining to the reader what the research is about and why it is being conducted.
Hi, my name is Danielle Hudson, and I'll be covering sample size and research design. Phenomenology was the type of qualitative research that was conducted in this study. Purposive sampling technique was used, and unlike randomized sampling technique, this affected the validity of the study due to high chances of bias. Biases were identified, and these were the criteria put in place to intentionally exclude individuals that may otherwise have been qualified participants. Such biases were the age ranges, because they did choose people that were only in the geriatric wards, and another bias was the language barrier. There were 14 participants in the study, and the participants were chosen from thoracic and geriatric wards of medical centers in northern Thailand. The study had 12 men and 2 women between the ages of 63 and 86 years old. The criteria for selection were clinical diagnosis of COPD, hospitalization due to pneumonia or acute exacerbation within the past year. They had to be over the age of 18 years old. They had to speak Mandarin or Taiwanese. They had to be open to interview and digital recording, and they had to provide informed consent. Criteria that excluded people from the study were lung cancer or pulmonary tuberculosis, those who had heart disease, or people who had cognitive impairment.
My name is Caitlin Norris, and I will be talking to you a little bit about the validity and reliability of the study. This study was proven trustworthy by adhering to credibility, dependability, transferability, and confirmability. Each interview was conducted by the first author, who was not a staff member at the hospital where the participants were chosen, and shared no healthcare provider relationships with such participants. The interviewer was a doctoral candidate with more than 15 years' experience as a lecturer and received qualitative research training in her master's and PhD courses. Credibility was achieved by the interviewer trying to avoid using her experiences and ideas to guide the participants to talk about their minds and feelings. All the transcripts, data coding, and theme formulation were reviewed by another author. The first author's advisor. A precise transcription of all interview recordings were read several times and confirmed by the first author to achieve dependability. Transferability was met through a rich description of the content of participants from different levels of severity in COPD. And conformability was enhanced with a rigorous audit trail of data and procedures.
I'm Jamie Blythe and I'm a part of Group 9. I'm going to talk about a little bit about the literature review, the ethical considerations, and the operational terms. In the literature review, we were unable to find a literature review for this study, although we were able to find something similar. In the introduction of the article, it discusses evidence about COPD patients who are more prone to problems in everyday life after acute exacerbation or pneumonia. A total of 20 articles were reviewed in the making of this article. The articles range from 2016 all the way to 10 years before that. All of the resources used are relevant to the topic being studied. They give direct information about the subject being studied as well as statistics that help explain their conclusions to their studies and how it relates to the lived experiences of people with COPD following hospitalization for acute exacerbation or pneumonia. The method of data collection was adequately described and justified in this article. A qualitative approach was designed for data collection through semi-structured interviews. The data was gathered through triangulation. Triangulation is when two or more methods by giving 14 different interviews to a group of people in different settings over a year. There were ethical practices used to conduct this research. For example, the article states the subjects studied were not handpicked based off religion, looks, or culture by any means. The participants were not forced to take the study and they chose to do it voluntarily, which was explained to the participants at the beginning of the study. The patients' names were never given out during the study or stated in the article, and their personal identification was kept confidential at all times. Operational definitions were given during this study. For example, participants described their experiences on how to live with COPD. These participants described how this condition affected their everyday life. In conclusion, healthcare practitioners can focus on working towards educating and serving people with COPD. They can help them learn how to deal with breathlessness and offering information to assist them to choose a more suitable oxygen delivery device for improving their activities. The study is clarified because they describe the scientific purpose behind the study and why it was done. As well as that, they describe and explain what healthcare practitioners decided they would do to help fix this problem.
The limitations in the study were: 1. Participants were limited to people with COPD. 2. The sample size was limited to patients that were hospitalized at medical centers in northern Taiwan. 3. Participants were only interviewed once. 4. There was only one source of data collection. And 5. There were no further follow-ups.
In conclusion, we as healthcare professionals should encourage people with COPD to be positive. We should also teach them ways to self-manage their disease. In this study, we got to explore the lived experiences of people with COPD following hospitalization for acute exacerbation or pneumonia. Many of them stated that they spent less time outside because of fear of not being able to breathe. They felt trapped in like an invisible cage. They also found that wearing a mask actually increased their breathlessness. So alternative methods are needed for preventing respiratory tract infections and protecting against respiratory pollution. This study shows that we, as healthcare professionals, need to focus on working towards educating and serving people with COPD on how to deal with breathlessness and offering information to assist them to choose more suitable oxygen delivery devices for improving their activities. This concludes our presentation of qualitative research on the lived experiences of people with chronic obstructive pulmonary disease. Thank you for watching.